Welcome back to Health Bulletin. Join us for an informative episode on the increasing monkeypox cases in Congo and the evidence reported by WHO pointing to viral evolution. The World Health Organization has confirmed the first case of sexually transmitted clade 1 monkeypox virus, which occurred in a Belgian resident during a visit to Congo. Mpox, formerly called monkeypox, has been endemic in parts of Central and West Africa for decades, where it mostly jumped into humans from infected rodents and caused limited outbreaks. Last year, 2022, epidemics triggered mainly by sex among gay and bisexual men in Europe hit more than 100 countries. WHO declared the outbreak as a global emergency, and it has caused about 91,000 cases to date. There are two recognized strains of Mpox, clade 1 and clade 2, with clade 1 being the more virulent. As per the WHO report, the person in question was identified as gay and had multiple sexual contacts during his visit to the Democratic Republic of the Congo. As far as the transmission is concerned, he displayed symptoms upon arriving in the country, and since the incubation period for Mpox is typically longer than a single day, it is likely that exposure occurred outside the Democratic Republic of the Congo. After consulting a doctor a few days later, on March 23, the individual was identified as infected with clade 1, Mpox. Through contact tracing, authorities identified 27 individuals who had been in close contact with the man during his time in Congo. 5 cases of infection were confirmed, involving 4 men and 1 woman. This cluster of monkeypox cases is also the first recorded instance of Mpox, clade 1 transmission among homosexual men. Since 2022, a global outbreak of Mpox infections, which are also sexually transmitted, has been ongoing. However, this outbreak is from the less virulent clade 2 strain of the virus and is also mainly driven by homosexual contact. The WHO has confirmed ongoing global MPOX outbreak and sexual transmission of the clade 1 virus, urging all countries and healthcare workers to take note. Hence, it is highly recommended that countries maintain their adherence to the WHO's recommendations issued in August 2023. So far, Congo has documented 12,569 suspected cases of monkeypox this year alone, marking the highest number of annual cases ever reported, as stated by the organization. With a reported mortality rate of 581 suspected monkeypox-related deaths, the risk of Mpox further spreading to neighboring countries and worldwide appears to be significant. Virologist Tamori said that even those figures were likely an underestimate and had implications for the rest of Africa, given the continent's often patchy disease surveillance. The Democratic Republic of the Congo is experiencing a significant increase in the number of suspected cases reported in 2023. The geographical spread of Mpox has extended to the southern and eastern provinces of the country, affecting new areas. Our understanding of Mpox is limited from an epidemiological and scientific perspective, and there is a lack of clarity regarding its transmission modes within the country. In 2023, cases of Mpox have been officially documented in the densely populated urban region of Kinshasa and in several previously untouched areas for the very first time. For the first time, there is documentation of sexual transmission of MPOX caused by clade 1, Mpox, raising the possibility that chains of transmission may have gone unnoticed. Key populations have a higher rate of HIV infection compared to the general population. Both the general population and key demographics lack adequate awareness of Mpox and its associated risks. However, national response capabilities face challenges, including a lack of sufficient epidemiological data on exposure and infection risk factors. Public awareness of Mpox is limited, and preventive measures face competition from various other priorities. Collaboration and coordination among partners are essential to sustain vital research and ensure a strong response at all levels, from national to provincial and local. Furthermore, supporting the assessment of a high risk of international Mpox spread. The initial reported outbreaks of clade 1, Mpox linked to sexual contact involve individuals with a history of international travel across WHO regions. The introduction of this clade into different and possibly overlapping sexual networks could increase the spread of this historically more virulent strain of the virus. A simultaneous outbreak of MPOX is happening in the neighboring Republic of Congo along the Congo River ecosystem, and its connection. These factors pose an additional risk of MPOX outbreaks with potentially more severe consequences than the one which has been affecting the world since 2022. Meanwhile, WHO advice. Infection with clade I, Mpox may lead to an increased risk of severe illness. Hence, it is strongly recommended that countries adhere to the WHO guidelines, including enhanced surveillance, improved diagnostic capabilities, community engagement and vaccine availability. We also require further research on transmission and assistance for quick diagnostics and patient-centered treatments. It's crucial to stress the significance of conducting case investigations without stigma and fostering a deep understanding of human-to-human transmission of monkeypox in communities. We must enhance the One Health approach in regions where the monkeypox virus may circulate among potential mammalian hosts or reservoirs. We need to improve our understanding of the links between Mpox and HIV infections. This involves integrating surveillance and case management into a flexible healthcare system that caters to the specific needs of the population. WHO advises against any travel or trade restrictions for the current outbreak. Individuals with Mpox should adhere to local health authorities' instructions, including isolation when possible during the infectious period. Close contacts of a confirmed case should monitor themselves for symptoms, practice good hygiene, avoid contact with vulnerable individuals, and refrain from non-essential travel for 21 days after the last contact with a person with Mpox. For treatment which is based on taking care of the rash, managing pain, and preventing complications. In addition, specific antiviral medications such as tecovirimat can also be used in the treatment of Mpox, particularly for severe cases or individuals at higher risk of complications. Antivirals clinical trial is ongoing in the Democratic Republic of the Congo in 2 district hospitals in the provinces of Maniema and Sankuru. In order to access tecovirimat in the country, a request can be made to national health authorities. MVABN, first approved for the prevention of Mpox in 2019, and the LC16KMB vaccine approved for Mpox in 2022. These vaccines offer 66–90% protection against Mpox. Vaccination against Mpox is recommended for persons at risk of contracting the disease, including children, and persons who have been in close contact with someone who has Mpox. A few countries maintain stocks of vaccines against Mpox, especially since the start of the global outbreak in 2022. As far as U.S. infections is concerned, according to the U.S. CDC, there have been 92,000+ confirmed infections globally since the Mpox outbreak in the past year, as of November 21. Out of this, 90,076 cases were identified in locations that have not historically reported Mpox. The WHO offers evidence for the importance of proactive treatment and containment of Mpox in the coming years to the global health community.
Thanks for watching.